Joining us now is Dr. Dhaliwal, and we're going to be talking about regenerative health. Welcome to the show. How are you?
Thank you. I'm doing great. How are you?
Good. It was almost like science fiction. We were having this conversation in the green room right now, and we were talking about the fact that I thought it might have to do with platelets and spinning blood and things. You said, no, this is a little different.
Yeah.
So what is this? What are we talking about?
So what you were referring to was a PRP, which is like where they use centrifuge and they take platelets and they basically inject it back into your body. So this is completely different. This is a new form and a revolutionary field in medicine called regenerative medicine, in the sense where we're using stem cells from amniotic cords and taking those cells. It's a form of like tissue engineering and molecular biology, which actually helps to repair your muscle tendons, ligaments, and actually just helps increase like the repair cycle, rebuild and regenerate basically tears.
Now, you grew up in Canada, which means that you grew up with good health care, right? At least that's what we're told here in the United States, that Canada's they've got a great healthcare system. So growing up in Vancouver, at what age did you realize that maybe you wanted to do something in this field?
So I was always interested in biology. I was always interested in sciences, and, coming from an immigrant family, you don't have many choices, either doctor, lawyer, engineer.
Really? Okay. All right.
Being from an Indian family.
Yeah. So that's, it's the same over there. No matter what country they go to, they want you to grow up to be something.
Exactly.
Okay.
So I was really interested in law, and then, my mom was like, you should be a lawyer or a doctor. And I'm like, okay. So applied. I got into this special 6-year program straight out of high school at the Royal College of Surgeons in Dublin, Ireland. Was there for 6 years, and then from Dublin moved to New York City about 12 years ago.
Nice. Did you like Dublin, Ireland? I heard that that's also a beautiful country, like rolling hills of green everywhere, and
it's beautiful except that it rains all the time.
Really? Okay.
It rains all the time. There's a funny shirt that I saw. It was like seasons in Dublin, Ireland, and it showed a cow, and it was like summer raining, fall raining, winter raining.
And then you came to New York and you got your residency. Let's talk about that opportunity for you.
Yeah, so I actually applied here, got into Mount Sinai in 2011 to 2014. And I always thought I was going to move out, but I just fell in love with the city. I think it's really conducive to my exuberant personality.
You do have, you walk in the room and you are, there you are. So when you decided now you do your residency, and then you decided to start not just like you by yourself, but you started a whole plethora of things. What is this? What is this partnership? What did you do?
So after,
were you lonely? You're like, I don't want to work by myself. I'm gonna get some friends together.
So what happened was while I was in residency, I started consulting down in Financial District for this medical startup, and I just wanted to see what there could be outside of medicine, but still in healthcare. So did that for 3 years. I was associate medical director of that. Then I decided to start a healthcare staffing company. Did that for a while, was a consultant, and then the way I got into this was actually I was a patient.
Hockey injury or some sort of injury? Tell us about that too.
So I played hockey at Chelsea Piers and actually tore my ligament here. And it was brutal. I was just in pain. It was a slight tear. Did PRP, like we talked about the platelet centrifuge stuff, and then did steroid injections. Nothing helped. I couldn't I was always in pain. I was I didn't have that much strength. My loss of functionality. Then I actually got surgery. You can see a little scar here.
Barely noticeable.
Thanks, it's the hair. Got surgery, and then even after surgery, was doing physical therapy. Even 4 months after, just still didn't have the strength. And it's being a doctor, I work at Lennox Hill as well, and just being able to use your arm, and just it was just always in pain. It was weak. So then someone told me about regenerative medicine. So then I flew down to Atlanta, got the injection. Small injection, takes a minute. Got the injection. They didn't use anesthesia. They just used the spray. Went in, injected. I swear to God, it was like Popeye eating spinach. I was like, whoa. I was like, what the? I'm not even kidding. I was like, that's what I'm so passionate about. I'm like, this is crazy.
So if it worked for you, you felt it would work for other patients in pain.
I was in the gym the next day, working out. I was back playing hockey. I know. And I don't believe in magic. I'm a scientist, right? So for me, I was just like, okay, this is amazing. I need to do this at home. So, and then started my RegenHealth Physicians clinic in March.
Congratulations.
Thank you so much.
What has been the reaction of some of the patients so far?
So we've actually gotten really good feedback.
Okay.
I remember when I was in Atlanta, we actually did a training. I actually injected an elderly lady. She was like 75 in the knee. And I don't think she was acting, but like seriously, she was in a lot of pain. I injected her. She literally got up and she was like, I feel like I can dance now.
That's amazing.
It's crazy. Obviously, it depends on the person.
Of course.
And comorbidities and
but
stuff.
some
like
people are having good results and it's worth a try.
It's exceptional.
The other night I was out to dinner and then I walked by an art gallery and this gentleman was telling me that he was deaf for the longest time. And then he took 5 pills and he was able to regain his hearing because it had to do with an inner ear infection that had never gotten cleared up.
Wow. I know.
And I believe what's interesting is that in the medical profession, you just keep trying. I think when we just stay stagnant, we're like, okay, this is the way you make a scrambled egg, and it's always the same, right? But what happens if you put a little paprika in it or something else? And I think medicine should be like that. Like, let's give it a try. We won't know until we try. So I'm happy for you.
No, thank you.
And so now did you get back on the ice?
Oh yeah, I'm back on the ice. I mean, summertime, but I'm back on the ice.
Okay.
I'm not as good as I used to be. I don't think I was ever good, actually.
Really? What position do you play in hockey?
I play like right wing.
Okay.
I play forward.
I'm friends with another Canadian, Kevin Weeks, who's goalie, famous goalie from the Rangers and stuff like that. And so I always laugh. I'm like, that's the other thing besides healthcare. Canadians,
it's
hockey.
It's a birthright.
It is, right? Hockey.
It's like you have to just play hockey. I mean, that's our birthright.
What makes you the happiest when you're working with your patients and you're being able to see results?
I think it really kind of stems down to the whole evolution of this field. For example, 10 years ago, 20 years ago, they're using stem cells for mostly research reasons. And now when we applied it, like you said, you just try something different. Now that we applied it here, you're seeing how fast they're literally like repairing muscle tears and things like that. I mean, it's amazing to see these patients, and I always follow up with them, how they're doing so much better, just helping their quality of life. I mean, that's the whole point. Like in the hospital, I work in internal medicine and, very sick patients and, they have a lot of comorbidities, heart failure, all that stuff. So what we can do is kind of symptomatically try to treat them. These people are actually like almost curing them. So that's amazing for me, especially being a physician. I've been a physician for 12 years now. This is really, truly I'm really grateful for the opportunity.
And is your mom, what are her thoughts now that she sees you all grown up and you're thriving? And
she's happy. She's just like, New York City's made for you. She's like, we always knew you were going to do medicine, but stuff outside. So I also got my MBA. So this actually helps me apply my MBA to this clinic and using it as a business.
Congratulations. Thank you for coming today. I always love meeting new people. I mean, that's what I do for a living. You love your patients. I love my guests. So I was all excited when I knew that you're coming in because I did a little research about it and I was like, wow, this is different. But not until you sat down earlier and we were talking about it, I was like, oh, this is really different.
Because it's like think about this, when you get injured, say you twist your ankle, all the blood flow goes there, then, the white blood cells and everything to repair it. So think about when you were a kid, you'd have a scratch and it'll go away in a day.
Ding.
So imagine taking these cells, let's call them little minions, right? They're like little minion cells. They're super cells. You take them out and then you basically help repair them. These cells are going to be working so fast. Think about it. They just made a baby. Right. They made a human being. So these cells are
fresh.
Yes, and potent and ready to rock and roll.
I fell in the driveway. I hurt my knee. I was screaming. Now I still have this little knot there, and I'm feeling it every once in a while. And I also fell and hit my head during COVID, and I wasn't going to go to the hospital. But every once in a while, I'm like, you worry, but especially okay, I'm over the age of 50 now.
No.
I truly am. I try to skew like I'm 42, but I'm not. But, and I do think about that. I say, as you get older, sometimes you also are prone to injury. So even if it's not your sports injuries when you're younger, you could have a fall and things of that nature. So it's nice to know that there's other opportunities to get better.
And it's not even old, older patients. I'm seeing 30-year-olds, 35-year-olds, just who used to be athletes and now just aren't 100%. And I've actually helped them significantly. And it's exciting stuff. It's just amazing how much you change your lives. Obviously, being a physician in the hospital, you can change your lives and hopefully, it doesn't take a drastic turn. This is actually helping day to day kind of, their functionality.
It's awesome. It's great to have you here. Thank you so much for being
Thank
here.
you.
Happy journeys to you. Stay tuned for more. We've been living it up, all right, with regenerative health. We hope that you found some value in this, and please Google them, go to their website, and find out more. Thanks for watching.